Hello, my name is Sunday Ajayi. Today I'm going to talk about post-menopausal bleeding and how we investigate and manage post-menopausal bleeding. Post-menopausal bleeding is a bleeding that happens to women who are in menopause. That is when you have had 12 months in which there's been no period at all. So any bleeding that comes after that period needs to be investigated appropriately because it's not normal. So the signs to watch out for any signs of any bleeding, it could be um, light bleeding. It could also be brownish discharge. So this needs to be investigated, and you need to contact your GP. We will then send you to the hospital or to the clinic for an urgent review with us as a gynecologist. In terms of what we do next is that we will I will see you and then ask more history, looking at asking when the symptoms started, and also um, trying to find out a bit more about your history, any family history of cancer, previous gynecological problems, any medical history, and also your medication history. And after that, we then might need to examine abdominal examination and a full pelvic examination. Also, one of the things that we also need to find out is what is in terms of your cervical smear history. We need to make sure that you're up to date. If you're up to the age of 65, but if after that, then you are ceased from the cervical screening program. Full stop. In terms of the causes of post-menopausal bleeding, we have the commonest cause, which is vaginal, called vaginal atrophy. This is when women who are in the menopause, because of the lack of estrogen, the tissues in the vagina are quite sensitive, and that can bleed even with or without intercourse because of the changes. Also, one of the causes also is that of it could be some inflammation in that area as well. Or you could have it could be a cervical polyp or even endometrial polyp, which are benign causes, and that can also cause bleeding. But more importantly, for postmenopausal bleeding, the major cause that we're worried about is the risk of what we call endometrial hyperplasia, which is a pre-malignant condition that can lead to endometrial cancer. And also, we're also worried about endometrial cancer. And that is why if any woman has a postmenopausal bleeding, that this needs to be investigated so that we can rule out endometrial cancer. So, in terms of what we do next, is that we will then send you for a pelvic scan to check on the thickness of the lining of the womb. And if the thickness is less than 4 millimeters, then this is reassuring. And if you add this with a normal pelvic examination, if the cervix looks normal, then we are reassured that we don't need to do anything more. But if the endometrial thickness is more than 4 millimeters, then we then need to proceed to the next step, which is doing an endometrial biopsy. This is when we use a very thin, very tiny plastic to obtain some cells from the lining of the womb to check for any abnormality. If we don't get enough sample, or we can't do endometrial biopsy for whatever reason, then we then need to proceed to do a full hysteroscopy. This is when we use a very small, fine camera, which is then passed through the neck of the womb to have a look inside the womb itself, to have a look to check for any abnormality. This can be done in the outpatient setting for most women, but in a small minority of patients, if they can't cope with this in the outpatient setting, then this might need to be done in theater under general anesthesia. What we're looking for, we're trying to look inside the womb itself to have it to check for any abnormality, to check for any suspicious lesion or polyps, which needs to be removed. And also we take a good sample from the lining of the womb so we can check for any abnormality. We are looking for endometrial hyperplasia, which is a pre-malignant condition that can lead to endometrial cancer. And also we are also checking for endometrial cancer, because if that is then found from the histology, then the next steps will be that patient will be referred to the gynecological MDT, and also patient will need further investigation with pelvic MRI scan, and then based on the grading of the cancer or the stage of the cancer, then further treatment will then be advised as recommended by the gynae MDT. Thank you.